Good morning, everyone. Welcome to this morning's press conference in regards to Husky. It is great to see so many people come out. It is something that is of utmost importance that we make sure that we try and provide our families that live in the state of Connecticut that do not have health care. It's important that we try and provide them health care, especially our immigrant population that contributes quite a bit to Connecticut. I'd like to thank Senator Miller for being here. I'd like to thank Senator Lesser for being here. What else is there?
Senator Kushner.
Senator Kushner, I'm sorry, I just said hi to you. Senator, Representative Farrar.
Representative Arsino.
Sir, thank you. Well, welcome for all the legislators here that have a strong support to make sure that we include more people in Husky. And it's just imperative, I think, to try and make this happen a little bit more than we are. Understanding the tight restraints that we have on our funding, it is still something that I hope that we can seek more funding in even pockets from last year and or some other areas that we might be able to find between now and the time that we get to the floor. Connecticut, like many other states in the United States, has a significant immigration population. According to American Immigration Council, as of 2019, approximately 14% of Connecticut's population was foreign-born. Many of these individuals come to the state seeking a better life for themselves and their families. However, immigrants often face significant challenges when trying to establish themselves in a new country, such as finding housing, employment, and health care, for which we are here today. There are several reasons why finding more money for Connecticut, finding more money in Husky for immigrants is important in Connecticut. Firstly, to access to health care. It is a fundamental human right.
Yes.
A fundamental human right. Immigrants, like all individuals, should have access to quality health care, regardless of their background or financial situation. Without access to health care, many immigrants may not receive necessary medical treatment or preventive care, which could lead to more serious health issues down the road, including them instead going to our emergency medical centers and creating a financial burden on our state that could be less if we would just provide them the health care that is necessary. Another reason why providing Husky for immigrants in Connecticut is essential is immigrants they contribute significant to the state's economy. Some people say, oh, well, they give in the thousands and the millions. No, they give in the billions in taxes and relief for our state. Another reason why providing Husky for immigrants in Connecticut is essential is because it can have broader benefits for the state as a whole. When individuals have access to health care, they are more likely to stay healthy, which can prevent the spread of disease and reduce health care costs in the long run. To make it a little shorter so others can talk, finding more money for Husky for immigrants is crucial in Connecticut. Immigrants are an important part of the state's population and deserve access to quality health care services. By providing health care to immigrants, we can ensure that everyone has the opportunity to lead a healthy and fulfilling life, contribute to the state's economy, and strengthen our community. I want you to look around and see the people that have come out to support. And this is just a small amount. And I just hope that we can find what we need in the budget, at least to bring the age up to 18. I'm going to repeat that. At least to only bring the age up to 18. And I believe that may be around $3 million. So I'm hoping that we can find that. Coming up next to speak will be Representative Kate Farrar.
Good morning, friends. I want to thank my colleague, Representative Nolan, for his initiative in bringing us together. And I just also want to personally thank, I know Senator Lesser is with us today, but I also want to thank Representative Gilchrist. Between the two of them as co-chairs of the Human Services Committee, they have been advocating side by side with so many of us in this room and through session to really make sure that we truly fulfill our value of healthcare as a human right and bring access to health insurance for all of our residents, regardless of immigration status. For me personally, as a representative now in my second term, I have to say that coming into the legislature, this was one of the first issues that I decided after hearing from so many of my constituents and so many folks in this room that this had to be a priority for our state, because having access to health insurance is not just the right thing to do, it is the smart thing to do for our state. And when we look at who we want to be as a state, especially for all that we learned coming out of a pandemic, we learned that health insurance, access to health care, is the most fundamental basic human right, but also the most fundamental smart thing we can do to ensure that not just our individuals in our community, but our entire state is truly healthy and can truly thrive. And one of the other things that we learned clearly through the pandemic was just how significant the gaps in our healthcare inequities are in our state. And one significant way we can close that gap is by ensuring that every single person has that true access to health insurance. As Representative Nolan said, we have made progress. We have seen year after year that folks in this building and our colleagues are hearing us that, that kids, in our state deserve health insurance, families deserve health insurance in our state, but we are not going to stop there. We're not going to stop with getting to the age of 12. As Representative Nolan said, we still have to keep pushing for greater access this session. And for me personally, when I think about this, I often think about this arbitrary kind of line of 12-year-olds that we've kind of put in the sand right now. And children beyond the age of 12, as we know, still have health issues, still have health concerns. We cannot expect our kids to thrive, to learn in school, to be the future here in Connecticut without access to health insurance. And beyond that simple sense of making sure that our kids have access to health care, we know in our state that we are spending millions, $63 million on uncompensated care to our hospital system. And so if we as a state want to save money, we need to spend a little bit more money so that we can save money, not just for our state, but in the potential medical debt that these families have from not having access to health insurance. So I stand firm and strong with all of my colleagues, with all of you here today, to say that, again, healthcare is a human right, but it's not just the right thing to do, it's a smart thing to do. And that's what will ensure that we have a healthy state where every single one of us can thrive. Thank you, Representative Nolan, and thank you for the opportunity and all the work that we have ahead.
Thank you, Representative Farrar. Next, we have Senator Lesser coming up to speak.
Thank you, Representative Nolan. Thank you for bringing us together and for your leadership on this issue. Thank you, Representative Farrar, and to all of my colleagues who are here. We've been joined, I think, by Representative Hughes, but we've got a cross-section of the state. And when I was appointed co-chair of the Human Services Committee at the beginning of the year, I had a conversation with my co-chair, Representative Jillian Gilchrist, and we were talking about what could we do as chairs of the Human Services Committee, and this was the first thing we talked about, because it's such an obvious place to start to help make the state healthier, help support families and kids across the state. And so we made it a priority. And it just simply makes sense. And if you had any doubts, go back and watch the public hearing we held in the Human Services Committee. For hour after hour after hour, we heard stories from providers, from teachers, from patients, from kids in our state, from young people in our state, from working people in our state, about what the cost is of not providing Husky for folks who are eligible or should be eligible. Right? We heard heartbreaking stories about a kid with a broken arm who didn't get their arm fixed. And if you think it saves us a nickel of taxpayer dollars to tell a kid who's got a broken arm that they can't get their broken arm treated, fixed, you are mistaken. Because when you talk to doctors, when you talk to our school-based health centers, our community health centers, our hospitals, anywhere in Connecticut, they will tell you that the cost of treating a broken arm is a lot less than the cost of not treating a broken arm. Because we're going to have to pick up that cost one day or another day. But an untreated broken arm so far down the road is going to have complications, it's going to have added costs, it's going to be, as Representative Farrar said, on our uncompensated care. They are desperate for us to do the right thing, to lead, to do the compassionate thing, to take care of kids in our state. We are winning. You know, a few years ago they said this could never happen in Connecticut. This bill wasn't going anywhere. And we surprised folks. We got it up to kids up to age 8. And then the next year we got it up to kids up to age 12. On Friday, we just had an overwhelming bipartisan vote in support of expanding coverage to age up to 15. But as Representative Nolan said, that's not enough, right? We got a lot of folks out there in the state who need access to health care. Your health needs don't stop at age 15. I wish they did. Unfortunately, they do not. And the amount of money we're talking about is really tiny in the grand scheme of things. It's really very tiny. So this is an opportunity. We have an opportunity this year to do the right thing, to make sure that kids in our state are covered. The young woman I met last week from Rocky Hill and Rocky Hill High School, that she can go to get the care that she needs when she gets sick. That we recognize the biggest lesson of the pandemic, that none of us are healthy if when our neighbor gets sick, they can't go to the doctor when they're sick, right? That's how we found out, what we found out in the pandemic, that diseases spread. And so we got to make sure that all of us are taken care of. That's how we're going to be a stronger state, a healthier state, a more prosperous state. Let's get it done this year.
Thank you, Senator Lesser. We have our Black and Puerto Rican chair here, Senator Miller. If you would say a few words, please.
Good morning, and there isn't much that I could add to the conversation. What's been said already. Health care is a human right. It doesn't matter if you're an immigrant, if you're a non-immigrant, documented, undocumented, black, purple, green. It's a human right. We all deserve health care. I stand here as the chair of the Black and Puerto Rican Caucus to say that the caucus has voted to support, to make sure that this bill, 1662, is one of our priorities. One of our four pillars is well-being and public health. This bill is about well-being and public health. We have to do better. Since I've been in the legislature, we've always taken baby steps to do what's right. We need to stop taking the baby steps and stand up and allow health care for everyone. Because as they stated, it's a fundamental right. In my district, we're having experiences with undocumented men who have alcohol abuse, substance abuse, and they're saying, I want to go and get treatment, but they can't get treatment because no one's going to pay for it. We have to do better. And I have to call out my predecessor. I call her Sister Truglia, but Representative Crystal Truglia, she told me in 2008, do not forget the children. I carry that mantra. She never forgot about the children. And I stand here today to say that I will never forget about the children. So as my colleague stated, it's not only healthy for the children, but it's healthy for the state. It makes us a healthy state, because what COVID has shown us is that we're not healthy. And I'm going to say this. Black and brown communities were dying disproportionately during COVID. And it needs to stop. And it needs to stop today. We need to step up to the plate and provide the health care that people need so that they can stay alive. So that people can live. So thank you very much for you all being here, and keep up the good fight.
So I'm extremely proud to bring the next person up. Not only is she affected by what we're going through, but we usually don't allow our interns to have a face in the place of us. But it was because of her that this was put together. I asked her about a month ago what was one of her main priorities. And though I supported Husky, and though we've been fighting for Husky for a long time, Jocelyn Diaz came to me and said, let's fight harder for Husky.
Yes.
So, because I am in the position that I am in, I can do nothing but move over for someone who means a lot and has grown a lot in the little bit of time that she's been here. So I thank Jocelyn and I thank Ariana, my CEC, for pushing this to go further. So I'm going to offer her a few moments to speak before we call up the next person. Jocelyn.
Thank you. Good morning. Thank you for gathering today to advocate and spur awareness for our House Bill 6616, an act concerning the expansion of Husky health benefits to those ineligible due to their immigration status. My name is Jocelyn, and I'm a student at Western Connecticut State University, and I'm here to support my community, human rights, and the right to health care coverage to all undocumented immigrants. When I first came to America and I began school, the first thing we did before we started our class was to say our Pledge of Allegiance. The last 3 words of our pledge goes as follows: justice for all. It does not say justice for some, or say justice for selected few. It says justice for all. Healthcare should be for all, because we are all the same. We're all humans trying to survive our daily lives. Healthcare should not be seen as a privilege, but should be considered as a basic human right. We do not decide when our bodies get sick, nor should it matter where we were born. Look around you. We are all the same on the inside. We all have hearts, we have lungs, we have blood running through our veins. These individuals behind me have experienced choosing between their child's health care needs or having food on their table, even if it's simple as frijoles con tortillas. After hearing all the testimony in the public hearing, no child should ever go through their lives without health care. No child should worry about getting sick. And no child should be left behind due to their immigration status. Everyone, especially children, should have access to healthcare services they need whenever or wherever they need them, without suffering the financial ruin. No one should No one should become sick or die because of their immigration status precludes them from receiving a healthcare coverage. Sigamos peleando para el seguro de salud para todos. Que Dios los bendiga y que tengan un buen día. Gracias.
And just once again, if it wasn't for Jocelyn, we wouldn't be here today. For her spirited effort in trying to push some concerns that she had. So thank you, Jocelyn. Coming up next, I'm going to call on Mr. Louis Luna and Dr. Kiki Kennedy. Louis is from Coalition. She's the Coalition Manager for Husky for Immigrants. Please welcome him.
Hi, good morning, everyone. I'm really excited to be here. I'm here with Dr. Kiki Kennedy too, and I'm going to be very brief on this. You know, as I was sitting here on one side, my heart was just like filled with a lot of love because this campaign has been a lot of love, but also a lot of strength, the strength of our community. I come from an undocumented family. I was undocumented when I was growing up. And when this campaign began in 2019, my niece, who's 14 years of age, I called her dad and I said, hey, there's hope for this. She had a tumor when she was a child. And because of that, she lost some brain function. She's an amazing, bright young person, but she needs a lot of help. This was 4 years ago. Now she's 18. She's about to turn 19. And the hope that I had, that we had as a family, to make sure that we extend Husky for everyone, it's slipping out of our fingers. However, what I want to say here today is that healthcare is a human right. And like we need to continue the expansion to get a list of 18 years of age today, and then get to my niece, get to everyone, get to the parents who are around here. If you look around, you have beautiful mothers who came here today from all over the state to say today that healthcare is a human right and that no one should be denied healthcare in this state. So we have an opportunity to expand this, and I ask legislators and I ask everyone here to continue fighting, to continue keeping our heads high, continue feeding each other's energy so we can continue this fight. Thank you all so much. And healthcare is a human right. And I'm going to pass it briefly to Dr. Kennedy.
Good morning. Thank you so much, Representative Nolan and Jocelyn, for convening us here today. My name is Dr. Kiki Kennedy, and I'm a physician who practices in New Haven. And I believe that healthcare is a human right. I believe that healthcare is a human right for each and every one of us, whether you are a child, a teen, or an adult, whether you are in school or in the workplace. We all deserve the right to basic health care. I believe that everyone should be able to access essential health care services, health care screenings, vaccinations, basic services where you can meet with your health care provider and ask questions like, should I be worried about this lump? Why won't my cough go away? What should I do about my sore throat? Meetings with a healthcare provider who can check you out and treat the small problems before they become major medical concerns tomorrow. Because when people can't access basic medical services like these, they wait, they delay, they worry that the cost of a healthcare visit may mean there's no food on the table that day and the next day. And this situation is happening every day here in Connecticut. Every day. People who lack documentation are frightened about their symptoms. They're struggling with pain. They're worrying about whether they can afford to see their healthcare provider. And those of us in this room who are privileged to have health insurance may have a hard time understanding that, or they think it doesn't impact them, but it does. Here in Connecticut, I believe that we are only as healthy as our least healthy community. When one community suffers, all communities suffer. So please, let's keep up the work that was begun 2 years ago. I am so grateful to all the advocates and legislators who have gotten us to where we are today, because we have expanded Husky, but only up to age 12. In January, when enrollment started, there was an incredible uptake. And when I hear stories from my pediatrician colleagues about young children who are finally getting their vaccines and their well child visits, I am so thrilled. But we need to keep going. So please, let's all get the word out to keep expanding Husky for all children today, up to age 18, and then keep working for all people, all adults in Connecticut tomorrow. I am so proud to be here. We are only as healthy as our least healthy community. Thank you.
Thank you, Dr. Kennedy. Coming up next is going to be Rena Ramos.
Bravo, Rena.
I'm sorry. And she is from the Connecticut Work Center.
Yes.
Buenos días, mi nombre es Rena Ramos. Vivo en Bridgeport, Connecticut. Tengo 3 hijos, uno de ellos vive aquí conmigo, 2 de ellos viven en República Dominicana. Soy miembro de Connecticut Work Center, soy madre, estoy aquí porque creo en la salud, es un derecho humano. Quiero contarle algunos de los problemas de salud de mi familia que han experimentado, con lo que hemos tenido que lidiar, ya que no tenemos acceso a un seguro personal porque somos indocumentados. Mi marido tiene problemas de visión y tiene mucho dolor de espalda, no tiene acceso a un médico, tiene dolores constantes y toma medicamentos sin receta. Sin embargo, él necesita atención especializada. Le mandaron a un doctor ortopédico y cuando fue a su cita le negaron verle porque no tenía seguro. Mi hija tiene 14 años y va a la secundaria, a la Harry en Bridgeport. Sueña con jugar baloncesto y en el equipo de esa escuela en el equipo de su escuela, pero tiene un soplo en el corazón. Su colegio le ha pedido que la llevemos a un examen completo con un cardiólogo que diga que puede jugar, pero no hemos podido hacerlo porque no tiene acceso a la salud para esta evaluación. Tenemos que pagar de nuestro bolsillo pero no en el bolsillo, no alcanza. Como madre me preocupa por ella y por su salud a largo plazo. Cumplirá 15 años en enero del año que viene y oro para que sea cubierta por Husky. Es solo una niña y como tantos otros niños quieren tener una vida sana y normal. Todos merecemos tener acceso al sistema sanitario, todos. Aunque esta ley no sea aplicada ni a mí ni a mi marido, Mi hija se beneficiará enormemente, pero que esta ley se apruebe y que espero que esta ley se apruebe y que mi hija pueda conseguir su sueño, el jugar en un equipo de baloncesto y más adelante convertirse en un agente de la policía del estado de Connecticut. Pido que este proyecto de ley se aplique más allá de los 15 años y que los legisladores aumenten los y que lo financien para cumplir más personas a más personas. Gracias por escuchar mi historia. Atentamente.
And I will be translating for what Rina Ramos said. Good morning. My name is Rina Ramos. I live in Bridgeport. I have 3 children. One of them lives here with me, and 2 of them live in Dominican Republic. I am a member of the Connecticut Workers Center. I am a mother. I'm here because I believe healthcare is a right, a human right. I want to tell you about some of the health issues my family has experienced and what we have dealt with since we don't have access to insurance as an undocumented people. My husband has a problem with his vision and his back. He does not have access to a doctor. He's under constant pain and takes over the counter medication. However, he needs specialized care. He was referred to see an orthopedic doctor, and when he went to his appointment, they refused to see him because he did not have insurance. My daughter is 14 years of age and goes to Warren Hardin High School. She dreams of playing basketball in her high school team, but she has a heart murmur. Her school has asked us to bring a full examination from a cardiologist, saying that it is okay for her to play, but we have not been able to do that because she does not have access to health care. For this evaluation, we need to pay out of pocket, but we cannot afford it. As a mother, I worry about her, and I worry about her long-term care. She will be turning 15 in January of next year, and I'm praying that she is covered under Husky. She's just a child, and like so many other children, wants to have a normal, healthy life. We all deserve to have access to health care, even though this law will not apply for me or my husband. My daughter will benefit greatly. I hope that this law passes and that my daughter can pursue her dream of playing on the basketball team and later becoming a police officer in the state of Connecticut. I'm asking today that this bill is expanded beyond age 15 and that legislators increase funding to cover more people. Thank you for listening to my story and taking my family into consideration and so many other families like mine. And I would like to introduce Jacqueline Soria from the Make the Road.
Muchas gracias, muy buenos días a todos y le doy gracias a Dios por esta oportunidad de estar presente y poder compartir mi testimonio. Gracias. Hola a todos, soy Jackie Soria, soy de Perú y soy líder del Comité de Lucha Como se hace Camino de Connecticut. Estoy aquí para apoyar la expansión del acceso a la atención médica para los inmigrantes. Estoy entusiasmada con el proyecto que puede expandir la cobertura médica porque es un paso más cerca a que todos tengan cobertura médica. Pero también estoy frustrada de que tan lento es el progreso. Yo tengo una niña Sandra, llamada mi niña Sandra de 13 años, y un niño Sebastián de 17 años, ambos menores de edad, Cuando llegamos a este país vi cambios en el comportamiento de mis hijos. Sandra comenzó a experimentar niveles de ansiedad de moderados a altos de ansiedad, tan intensas que le dolía el estómago y no podía comer o a veces ir a la escuela, ya que sufrió una parte de bullying en la escuela. Mi hijo mayor, Sebastián, está dando todo de su parte para hacer una transición sin problemas a un mundo completamente diferente, a nuevos proyectos, a nuevos cambios. Es un estudiante que realmente ha dado todo de él para poder salir adelante. Me dice la maestra, pero sé que se presiona y se preocupa mucho. Desde que llegamos aquí no ha ido al verse al dentista para nada, pero sus dientes están creciendo en direcciones separadas y eso también nos preocupa, ya que el seguro y la parte salarial no es justo ni se asemeja a lo que estamos nosotros teniendo el costo. Como les explico, tengo 2 hijos. No es digno que a uno se le dé la cobertura y a otro no. Uno que tenga 13 y el otro que tenga 17 años. Como madre no puedo darme el vínculo de poder aceptar a uno y al otro no. Es cruel, intolerable y es doloroso como madre. Me está pidiendo a mí, una madre de 2 hijos, que solo tenga la capacidad de cuidar a uno. Con la expansión, Sandra podría conseguir una terapeuta que la apoyara con su salud mental y sus proyectos para que ella pueda sentirse más protegida y realmente pueda experimentar, poder compartir su niñez. No tendríamos miedo de tener que ir al médico de costos financieros cuando ella se enferma. Sebastián podría tener acceso a cuidados preventivos para sus dientes y el poder ser atendidos y sus necesidades generales. Me sentiría un poco aliviada de que tuvieran la posibilidad de una vida saludable. Mi historia es solo una de muchas. Debe expandir el acceso a la atención médica más allá de los 15. 15 no es suficiente, mínimo debe expandirse a 18. Cualquier cosa por debajo es inaceptable y doloroso para una madre y para toda familia que está en esta nación. Dios bendiga a esta nación y que Dios bendiga a cada una de sus familias. Bendiciones y muchas gracias.
Hello everyone, I'm Jackie Soria. I'm from Peru. I'm a leader with the Fight Back Committee of Big Road, Hartford. I'm here to support expanding access to health care for immigrants. I have a 13-year-old girl whose name is Sandra. She's beautiful. And a 17-year-old boy, Sebastian. I'm excited about the proposal to expand healthcare coverage because it's one step closer to healthcare coverage for everyone. But I'm also frustrated at how long and slow the process has been. When we got to this country, I saw changes in behavior in my kids. Sandra started experiencing moderate to high levels of anxiety so tense that it made her stomach hurt, and she wouldn't want to eat or sometimes go to school. My older son, Sebastian, is just giving it his all to make a smooth transition into an entirely different world. He's a stellar student, the teacher tells me, but I know he puts a lot of pressure on himself and gets worried. Since we got here, he has not been to the dentist at all, but his teeth are growing in separate directions, and that worries us. How do I explain to my kids that one child is worthy of care while the other one isn't? It's heartless, it's intolerable, it's painful. You're asking me, a mother of 2, to only have the capability to care for one. With expansion, Sandra could get a therapist to support her with her mental health. She wouldn't have to fear going to the doctor and getting sick due to the financial cost. Sebastian could be able to have access to preventative care for his teeth and his general needs. I would feel a little relieved of having the possibility of a healthy life. My story is just one of many. Connecticut must expand healthcare beyond 15. 15 is not enough. At the bare minimum, it must expand to 18. Anything below that, it's unacceptable and it's painful. Thank you.
I would like to have Reverend Joshua Mason, sorry if I'm pronouncing it wrong, Pollock, British Minister, Unitarian Universalist Society East, and member of the JHIA.
All right. Yeah, I want to push it up. Thank you, Jocelyn, and thank you, Representative Nolan, for convening us. Thank you to all the elected officials, and thank you to the Husky for Immigrants campaign folks. As Jocelyn said, I'm the Reverend Josh Pollock. I'm the parish minister at the Unitarian Universalist Society East in Manchester. I'm also a faith leader with the Greater Hartford Interfaith Action Alliance, or GIA, and I'm a faith leader with the Recovery for All Coalition. And I want to say that while it is certainly a good thing that the Appropriation Committee's proposed budget adds funding to cover access to Husky for people regardless of immigration status up to age 15, it is insufficient. It is not enough. It's too small a change. Senator Miller was talking about baby steps. Was it you who were talking about baby steps? Someone was talking about baby steps. No more baby steps. We need HB 6616 to pass, and we need it to be amended to cover people up to 18. That's the bare minimum. That's the bare minimum. A little background, we at GIA joined the Husky for Immigrants campaign primarily based on our concerns about mental health. Our 50 congregations across the Greater Hartford region recognize that in Connecticut there is a mental health crisis. It predates the pandemic, though it certainly grew worse during these last 3 years of pandemic. We recognize that immigrants, regardless of immigration status, are just as likely to be living with mental illness or experiencing mental health crises, if not more so than non-immigrants. The immigrant, that gray legal area that so many immigrants experience, that is stressful. It is incredibly stressful. So expanding Husky to include immigrants who qualify is an obvious and relatively simple way to address mental health issues in immigrant communities, adapt the state structure that already exists. I know a lot of people who use Husky. It saves lives. It's a good program. It's there. Let's use it. It's the right thing to do. It's the humane thing to do. It's the compassionate thing to do. It's the moral thing to do. But oh no, wait. We can't do that. There's a spending cap. There are guardrails. This isn't a rainy day. You with me? Despite huge budget surpluses, despite a huge rainy day fund, despite the state's wealthiest residents generating huge profits throughout the pandemic, largely due to an unfair tax system, apparently we as a state cannot access these historic surpluses to invest not only in the health and well-being of Connecticut's immigrant communities, but to invest in anything that would make life easier for poor and low-income people in our state. Basic services, housing, education, gun violence prevention, the list goes on and on and on. We cannot access these historic surpluses. And what we don't often hear is that there are ways to overcome the spending cap. They are legal. They are constitutional. We've used them before. We ought to be using them now. Si hay dinero. I hope I'm saying that correctly. There is money. I want to speak. I want to send a message to Governor Lamont. And I want Governor Lamont to know that I voted for you twice.
Me too.
Me too. I did not vote for you to turn away from the people in our state who are most in need. I voted for you with the expectation that you would be bold, that you would be brave, and that you would invest in our people. Governor Lamont, we are living in extraordinary circumstances. Walk a mile in the shoes of an undocumented person without health insurance, and you will know this is not the time for half measures or baby steps or exceedingly small incremental change. Too many people's lives hang in the balance. So Governor Lamont, Fight for us. Fight with us. Be in la lucha. Declare extraordinary circumstances. Lift the spending cap. Challenge the legislature to do the same thing. Si hay dinero. To the Senate and the House leadership, I know you care deeply about people in Connecticut who are struggling. When you campaign, you consistently position yourselves as aligned with the people, with workers, with immigrants, with marginalized communities. Well, here we are. Fight for us. Fight with us. Be in la lucha. We have a chance to deliver for undocumented people the most basic of human rights, health care. Expanding Husky to age 15 is good. It is not enough. Please pass HB 6616 and amend it in the very least to provide access to Husky for people up to 18 years or old, regardless of immigration status. Si hay dinero. I have one more message to every other elected official. I say, and I really believe this, we can be fiscally sound, compassionate, and bold at the same time. These things, they are not mutually exclusive. Don't tell us about the constraints on the budgetary process. Don't tell us this is just the way it is, that the spending cap is there for a reason and there's nothing to be done. Don't tell us this is the practical reality. We don't want to hear it. And the reason we don't want to hear it is because we prefer that you think about the immigrant whose teenager is suicidal, who needs emergency mental health crisis now, crisis care now because this person couldn't get preventative mental health care sooner because coverage only goes up to age 12 and they're older than that. So for this family, for this teenager's family, this life and death situation is the practical reality. That's the practical reality we ought to be caring about. It doesn't get more practical than this. Embrace that practical reality. Fight with us. Fight for us. Be in la lucha. We have an opportunity to expand the healthcare safety net for young people in our state, regardless of immigration status. We didn't elect any of you to turn your backs on the most vulnerable. We urge you to be bold, be brave, go big, save lives. Please pass HB 6616 and amend it in the very least to provide access to Husky for people up to age 18, regardless of immigration status. Si hay dinero. Thank you.
Okay, this is our final speaker, and we're going to wind down to questions as soon as she gets finished.
So we're winding down, and we're going to have our last speaker, Constancia Segova, organizer of the Husky deportation, defense, I'm sorry. And then we'll be right after, we're going to be questions.
Thank you, everybody. I'm Constanza with Hartford Deportation Defense and Husky for Immigrants and Recovery for All. I think a lot of what I was going to say has been said. Muchos de los puntos que quería hacer ya se han mencionado, así que quiero dejar bien claro what we need. I want to leave very clear what we need. Lo que necesitamos es que nuestros líderes en la legislatura hagan lo correcto y expandan Husky hasta los 18 años de edad. Nada menos esta sesión es aceptable. Apoyaremos cualquier vía que logre este objetivo. So we need our leadership to do the right thing and expand Husky to 18 years old. Nothing less is acceptable this session. We will support any avenue that accomplishes this goal. We also need the state legislature and the governor to respond to needs with resources. We cannot prioritize fiscal responsibility over our responsibility to ensure that all Connecticut residents have access to basic human rights. Necesitamos que nuestra legislatura estatal y el gobernador de Connecticut, Lamont, respondan a nuestras necesidades con recursos. No podemos dar prioridad a la responsabilidad fiscal sobre nuestra responsabilidad de garantizar que todos los residentes de Connecticut tengan acceso a los derechos humanos básicos. Así es. Y por último, necesitamos que el presidente de la Cámara, Matt Ritter, el presidente del Senado, Martin Looney, y el gobernador, Ned Lamont, hagan todo lo posible para ampliar Husky hasta los 18 años en esta sesión y, muy importante, que se comprometan a largo plazo, en los próximos años, a continuar la expansión para que podamos llegar a cubrir a todas las edades sin importar el estado migratorio. So, lastly, what we need is for House Speaker Matt Ritter, Senate President Martin Looney, and Governor Ned Lamont to do everything in their power to expand Husky to age 18 this session, and to commit in the long term, in the next few years, to continue expansion so that we can cover everybody, all ages, regardless of immigration status, because healthcare is a human right.
So once again, I'd like to thank everyone for coming. This is, as you can see, extremely important to our communities. And we're hoping that we can find what we need to make the difference in the adjustment in what's offered now to make it at least up to 18. So thank you, and we'll take any questions.
Sure. Just had a chance to go through the appropriation committee budget. They say $3 million to go to 15. The Department of Social Services, in their testimony on House Bill 6616, said $15 million to go up to 18. Are those numbers right? Do you think those numbers are correct?
Would you like to? So, first of all, we just started up to age 12 January this year, and so we're really getting hard data for the first time ever. We have been working really closely with DSS to get good numbers. I believe that the $3 million figure is accurate. As we go forward, we'll get better numbers and we'll be able to refine that. But $3 million to go up to age 15, another 3 to go to 18. In the grand scheme of the budget, that is a drop in the bucket.
So you disagree with the DSS estimate that was provided, that would be $15 million? You're saying that was
26. So that was actually up to 26. That was the initial bill. So then we brought it down to 18 in the committee process.
How much would it cost to do everybody? Parents?
50.
It was at something around 80 million is my recollection. Yeah. And we're getting better data now because we have real world experience. We're providing healthcare in the community.
What's the estimated savings by providing preventative care to undocumented immigrants? Because we're talking about cost, but there's savings involved.
Absolutely. So.
I'm going to have Rosa come up because she's got some really good expertise with numbers.
So this is what we've been looking at cost-wise, is essentially we're looking at $3 million to go up to 15. It'd be about $8 million to go up to 18, and we're looking at covering about 5,000 folks. 2,300 folks. If we went up to age 26, we'd be able to cover about 5,000 folks at 18 million. For everyone, it's about 80 million. I just want to keep in mind, though, that when we say these numbers, there's also savings to hospitals. If we expanded to everyone, there'd be savings of roughly $65 million in uncompensated care, as well as a huge reduction in our emergency Medicaid spending. So we can't just look at how much something costs. We also have to look at what will it save, and as well as we've been talking about so much here today, the morality of ensuring that everyone's covered.
Yeah. So the benefits in the long run are more advantageous than not. So I think that it's a benefit for us to go up to 18 and save more as we progress. Any closing remarks by any of the legislators? No?
Let's go get it.
Let's go get it done.
All right.